All right, let's talk about antiemetics. Antiemetics, at the end of the day, they're a paramedic's best friend. If you have got a patient who is actively vomiting or who's likely to vomit, the best thing that you can do to make that patient comfortable and to make your job easier is to help that patient stop vomiting or make sure that the patient doesn't vomit. It makes for a cleaner ambulance, makes for a more comfortable patient and a more comfortable transport into the hospital. You'll see the indications right there, obviously used to treat nausea and vomiting. And as we mentioned in the opiate lecture, they are used as prophylaxis when giving an opiate medication. As a reminder, one of the most common side effects of morphine, up to 60% of the patients, is nausea and vomiting. So if you're considering giving morphine, you should think about giving a prophylactic antiemetic at least 2 to 3 minutes prior to administration. All right, the antiemetics that you're going to see as a paramedic include ondansetron. That's probably the most common. It's got the fewest side effects. The trade name is Zofran. Promethazine, also Phenergan, prochlorperazine, and also referred to as Compazine. So there are two drugs that work on the parasympathetic nervous system, and then one is an antihistamine. Remember, when we activate the parasympathetic system, what does it do to the GI system? It actually increases production of gastric juices, increases peristalsis, really ramps it up. So the two drugs that block the parasympathetic nervous system, and I'm going to go over how they block that in a minute, but they're ondansetron and prochlorperazine. Antihistamine, that's promethazine. We'll talk about that mechanism of action in just a second. So let's talk about ondansetron first. So how does ondansetron work? That reduces vagus nerve stimulation. Okay, and when we stimulate the vagus nerve, that has a direct effect on the parasympathetic nervous system. That's like slamming on the brake. And what ends up happening is you get a rampant GI production. The GI system really kicks into high gear when we stimulate that vagus nerve. There's other things that happen as well. You get hypotension, bradycardia, your pupils will constrict, so on and so forth. But what we're really concerned with an antiemetic, obviously, is the GI. So if we block all of this, we say no vagus nerve, what do we have? Decreased nausea and vomiting. Pretty straightforward with ondansetron. All right, so let's talk about prochlorperazine. What is that mechanism of action? That is an anticholinergic. Now, if you remember, what is the main neurotransmitter that we refer to as a cholinergic? It's acetylcholine. Okay. And now remember, acetylcholine affects two different receptors, okay? The nicotinic and the muscarinic, okay? Now, this is the one that we're really concerned about because this receptor innervates the GI system, okay? And when we activate acetylcholine and it activates this receptor, you get increased GI production. Okay, so if we give a medication, prochlorperazine, that says it's an anticholinergic, and it says, okay, we're going to block the production and release of acetylcholine, what do you get? You actually get the decreased GI production. That's how that works. All right, let's talk about promethazine here. Now you remember promethazine, this is an antihistamine. And if you remember our lecture for antihistamines, we're primarily dealing with H1 and H2 receptors. H2 is primarily GI. H1 is going to be more of your systemic and circulatory system. ran out of room there. So promethazine, I know your drug cards say it's an H1, but it is also an H2 blocker. And what we use it for is to block these histamine receptors. Obviously, when we block H2, we get a decrease of GI production. Pretty straightforward how that works. Promethazine and compazine, this is one of the medications that is going to be very common for causing dystonic reactions. We're going to talk about dystonic reactions later, but if you want to be familiar with it, this is one of the reasons that compazine has kind of fallen out of common use, is because it does cause dystonic reactions. It's very uncomfortable for the patient. It's not life-threatening, but the antidote is actually Benadryl for this dystonic reaction. But getting back to the slideshow, that's all I have for you. If you have any questions, make sure you submit them through Blackboard or bring them to class. Thank you.